Hi, good morning, Ransom Peter. My name is Mihiraa. Let's start the warm-up session. Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
Your preparation time is over. You can now start your role play.
Good morning. My name is Ransom Peter, and I'll be your nurse today. May I know your name and age, please?
My name is Mihiraa, and I am 56 years old.
Mihiraa, may I know the reason for your visit, please?
Nurse, I'm currently undergoing chemotherapy treatment. Since yesterday, I've been feeling unwell with a fever and general discomfort. And I'm really worried. That's why I decided to come to the emergency room.
I'm sorry to hear that, Mihiraa. Can you describe your symptoms in more detail?
I have all the symptoms of severe fever. I've been feeling very weak, my muscles ache a lot, and I've noticed some difficulty breathing. There's also this rash that's appeared recently.
I understand you're feeling quite unwell, Mihiraa. It's concerning to hear about the severe fever, muscle aches, difficulty breathing, and the new rash. Given your chemotherapy treatment, it's important for us to rule out a serious infection called sepsis. Mihiraa, some of the symptoms you've described, like muscle aches and difficulty breathing, are similar to those experienced by patients with sepsis. To get a clearer picture of what's going on, I'd like to run some blood tests. These tests will help us determine if there's an infection present and its severity. Don't worry, these are routine tests and will help us develop a plan to make you feel better.
Oh no, that sounds serious. What exactly is sepsis, and how could I have gotten it?
I understand your concern, Mihiraa. Sepsis is indeed serious. It's a condition where the body has an extreme response to an infection. When sepsis occurs, the infection-fighting processes turn on the body itself, leading to widespread inflammation. This can spread rapidly and potentially cause tissue damage, organ failure, and even death if not treated promptly. Given that you're undergoing chemotherapy, your immune system is weaker than usual. This makes it harder for your body to fight off infections. Since your immune system is compromised, a simple infection can escalate quickly into sepsis. But please know that we are here to help you through this, and we'll start treatment immediately after the blood test results. Your health and well-being are our top priority.
All right, what will we do if it's sepsis?
That's a good question, Mihiraa. If it turns out to be sepsis, the treatment will involve a few critical steps to manage the infection and support your body. First, we'll start you on intravenous antibiotics to fight the infection. These antibiotics are administered directly into your bloodstream to ensure they act quickly and effectively. Along with antibiotics, we'll also provide 4 fluids to help maintain your blood pressure and keep you hydrated. Sepsis can cause your blood pressure to drop dangerously low, and these fluids will help stabilize it. Additionally, you'll be closely monitored by our medical team. We'll keep a constant check on your vital signs, such as your heart rate, blood pressure, and oxygen levels, to ensure that you're responding well to the treatment. Throughout this process, we'll make sure you're as comfortable as possible and keep you informed about each step we take. It's important to address any concerns or questions you might have. Is there anything specific you're worried about or would like to know more about?
I understand. I'm feeling quite anxious after hearing all this. I'm worried about how serious this could be. Is sepsis worse than the cancer I'm already fighting?
Mihiraa, it's completely understandable to feel anxious given everything you're already dealing with. Sepsis is serious, but the good news is that it's treatable, especially when detected early. Unlike cancer, which often requires long-term treatment, sepsis treatment is generally short-term and focused on eliminating the immediate infection, which means it can often be cured quickly with the right medical intervention. Our immediate goal is to identify the infection and start treatment to prevent any complications. The steps we take, such as administering 4 antibiotics and fluids, are highly effective in treating sepsis. We'll also adjust the treatment as needed based on how you respond, ensuring you get the best care possible. Your resilience in fighting cancer is already remarkable, and we're here to support you through this as well. To move forward, we'll need your consent to perform the necessary blood tests. This will help us confirm the presence of sepsis and tailor the treatment to your specific needs. Can we go ahead with the blood tests?
All right, I consent to the blood tests. Let's get this done.
Thank you, Mihiraa. We'll get started on the tests right away and keep you informed at every step. Rest assured, We're here to take the best possible care of you.